Attributes of elite groups. Number one, clear organizational mission and identity. What does it mean to practice medicine here? And they would answer with specificity and clarity and pride as to what your organization stands for and what their responsibility is within that. Number two, the group mission trumps any individual. Our mission is not the hospital agenda, because if you cast it that way, they're going to say, I don't think so. Your mission is world-class care, world-class experience, done in a coordinated, evidence-based fashion. Trust in leadership. The leadership does things that fosters trust, because it is about reciprocity. The physicians will do for you what you have done for them. Careful selection of members. This is an exclusive club. We only take the best. And we would rather work short than work with the wrong people. That is an attribute of great organizations, and great organizations have an intolerance to low performance. Anything that compromises the mission is sacred. You don't mess with it. Building physician leadership. Leadership is identified as the most important ingredient in transformational improvement. They are empathic, intense, passionate. They know their limitations, because I think self-awareness is a critical attribute. I mean, people who don't know what they don't know is a scary leader proposition. Great leaders are intensely confident in what they can do, and they know exactly. They tend to ask questions. I don't know what you're saying right there. I don't understand that line on that balance sheet. Explain that to me. They ask questions, and they know exactly when to call in for help. Patient satisfaction is a reflection of physician performance, right? I mean, there's lots of implications for that. Loyalty, lots of them. So clinical performance, and that is going to be a basket of things up to you, but there's going to be processes and outcomes. Hopefully more outcomes and get away from processes, but there's a basket of things that are going to be reflective of physicians' clinical performance. So you had a physician who's best in class in their clinical set and 99th percentile for patient satisfaction. Are we good? What else do we need to?
Cost efficiencies.
Cost measures. Absolutely, cost measures. So if you start, people say all these measures are the same, but that appears to be the one that others are paying the most attention to. And that is, what is per admission Medicare beneficiary costs? I can guarantee you that's being tracked. Bringing it from organizational vision to performance to goal setting to performance assessment and feedback to actually how you actually get it to happen. What are the evidence-derived behaviors that make patients walk out and say, this place, this physician, this brand is real?